Hello, my name is Dr. Paul Hrkal. I'm a medical advisor with ALR. Welcome to our webinar about the truth about detoxification, effective elimination through nutrition and supplementation. Again, as part of our webinar series for 2013, we're going to be talking about different topics, and this is the third topic we're going to be talking about, detoxification. It's one of those topics that is very kind of out there in the media, it's out there in the natural health product world and in the industry, but there's a lot of myths and things that people don't really have a full understanding. So what we're going to look at today is we're really going to try to unwrap this theme of detoxification and try to get an understanding of how our bodies actually go through this process. So we're going to tackle some questions. Do we even need to detoxify? Because there are some people out there that actually feel that our bodies will do that normally, or we don't need to use any extra detoxification. We'll look at some common myths and misconceptions when it comes to detoxification. We're going to look at some of the science and background and look at the way that the body has built-in elimination pathways and what we can do to support those pathways to promote healthy elimination and detoxification. Part of that will be a big nutritional piece. Part of it will be an environmental and lifestyle piece, and then we're going to finish up with some key supplements that will help kind of push us through different pathways, and if certain pathways are sluggish and or other pathways are working a little too hard, we'll kind of address that. So that's the plan for today. Just a little bit about me, as is customary with all of the webinars that we do. I'm a medical advisor with ALR, and I have a private practice in the GTA, Toronto, Mississauga area. And my passion, again, is all about education. That's part of what I do with ALR, and what I'm going to be doing today, talking about detoxification, is really distilling down what the key facts and what the science is saying about certain health topics, and in this case, detoxification, and then allowing you to use it better and to ultimately improve the health of yourself and your families. Okay, so I think with anything, when we look at any health topic, we need to look at a historical perspective just to kind of give us a broader appreciation for this topic especially, because detoxification and the theme of elimination and purification has been used in lots of different cultures for thousands of years actually. Anything from fasting, you can see that even some traditions in the Roman Catholic faith and the Islam faith, there is like Ramadan is a period of fasting, and that's something that has been carried on from a kind of a cultural, religious perspective, and it's now carried on even into present day. And there are some health benefits that are supposedly associated with that. There's saunas, hydrotherapy, especially in the Nordic communities, in the Russian culture. There's a huge following of hydrotherapy, hot and cold waters. And of course, there's a number of herbal therapies from all over the world that have just helped or traditionally been used to help the body eliminate certain things and kind of go through the detoxification process. So we need to have an appreciation that this has been used for hundreds of years, like unlike cardiovascular health, where the idea of improving a person's heart has been there for a long time, but in terms of specifically going through vascular health has been kind of a recent concept. Detoxification is a much broader and more historical concept. So what do we mean by detoxification? As I'm going to talk about, the wording and the semantics of science, and in this case detoxification, is very, very important, because we kind of use that word detox to cover a lot of different things. But when we distill it down, it really can be looked at as the removal of toxins from the body, toxic chemicals, substrates, or substances. But there's two key differences. There is the removal and elimination of normally produced cellular waste, and this is called endogenous detoxification. This is what naturally occurs in the body, that the wastes that the cells make from normally making energy. And the second part is removal and elimination of exogenous or external pollutants, toxins, and foreign compounds. So there's two aspects of detoxification, what we normally produce and what we actually take in through our environment and our diet, and they both need to be eliminated. So what do we need to detoxify? So there's a few kind of key concepts or questions that kind of come up right away when a person looks at detoxification, even from a more skeptical approach. Can normal detoxification pathways cope with the load that the present human is put under, from an environmental perspective, from what we put into our mouths through our diet? We also need to look at the historical versus current exposure of our environmental toxins and things like pesticides, which I think we all have a fairly good appreciation for as being a consideration for sure, and that's why this whole market of organic has kind of come up, and more people are switching to organic because they feel that there's less contamination. Also, another concept is this idea of a cumulative effect or a synergy between the toxins. And this is very interesting. We're going to touch on each one of these points, and this one specifically. There are some diseases now that are being linked to not just one or two toxins or pesticides or whatever we may have, but there's actually, we don't know how the combination of not just 1, 2, 3, even sometimes 10, 11, 20 different toxins or pollutants interact together. So there is some evidence for a cumulative effect. And as we build it up in our bodies, what about some of the accumulation that occurs within a person's body and being stored, especially in the fatty tissue, because a lot of toxins have that affinity for the fat. So these are some key concepts we need to keep in mind. So let's kind of, even before we get into some of the details, let's look at why we even would need to detoxify. Some really broad concepts. This is a very large field and often very confusing. I'm going to try to really distill it down here. If we look at cancers, there's actually some evidence showing that majority of cancers are environmentally induced or environmentally caused, linked to some sort of thing in our environment that could possibly be modified. We used to think that a huge portion of our diseases are genetically linked, especially our chronic diseases. But what we're finding now more is our environment, and especially from the influence of things like toxins, and in this case you can see xenotoxins here, they actually have the ability to change genetic expression in a field that's growing called epigenetics. So that's the influence of the environment and what it has on our genome or our genes. So think of it as almost an on and off switch. Depending on the environment, this can be an environment that has lots of toxins and pesticides, and that environment actually will predispose our genes to either be usually turned on or off, and so it'll turn on some of the negative ones, and it may turn off some of the protective ones, for example, the anti-inflammatory genes. Also, though, you can see the second point here, that there's a number of evidence, and this is just one kind of choice that I picked out because there's a lot of studies being put into mothers and the exposure to neonates and babies, that there's actually quite a bit of evidence supporting that what we have in our environment is transferred to our mothers and also into the fetus. And there was a study that was done in Michigan State, found that DDT, which is a very common and a known carcinogen or cancer-causing agent, was found in over 70% of 4-year-olds, and it was through their breast milk. So the idea that toxins are not present can no longer be denied. And now whether they actually have a negative effect sometimes can be contentious, but the evidence is very strongly growing that there is a negative effect. And so I'm going to look at one specific thing, obesity, that has really been skyrocketing in terms of numbers over the last few years. So there's a term called obesogens, and it's not a well-known term, but it's a term that's now being thrown around in the functional medicine field, where it's basically referring to how toxins are linked to obesity. You can see there's really recent evidence linking that. And so what the idea and the evidence for this specific term is actually come from a number of studies that have actually looked at the amount of toxic substances that were stored in a person, and specifically in the fat of a person. The majority of toxic substances have affinity for our fatty tissue. That's the area where a lot of things are actually stored by the body. So there's a theory actually out there saying that the amount a person has of excess weight, obesity, can be actually, or a piece of that has to do with actually almost trying to dilute the toxic load that they have. So this is a field called again, that epigenetics of how it's impacting our genes, but also a term called obesogens, of actually toxins being stored in fat, and also promoting things like inflammation and continuing fat growth and deposition. The same thing actually is being termed for diabetes in a term called diabesogens, where specific molecules, compounds, can go in and alter the function of insulin receptors. So now the insulin can no longer do its job of putting glucose into the cell. So now we're starting to see how, again, that next step of, we have lots of toxins in our environment. The next step is, do they have an effect on us? And this is evidence in one very specific aspect where it's starting to have an effect on us. Another very commonly well-known, kind of like DDT as I mentioned, bisphenol A is another well-known environmental pollutant. And so this one is now being picked up by the marketing and departments by a lot of companies, where they're finding they're advertising actually on their plastic bottles, they are saying they're BPA free. And so now we can really even see that there is definitely a trend that is going away from having BPA inside of a plastic. And it's basically a plasticizer. So what BPA does is just makes the plastic a little bit harder. And actually, a lot of the BPA is found not just in plastic bottles, but the inside coating of metal cans. So for example, like a can of soup, there was a study showing that just eating a can of soup for lunch increased the amount of BPA students had in their urine. So it has a very rapid and quick effect. And it has been linked, BPA has been linked to a negative effect, and specifically on hormones. So there are other different things like mercury will have an effect on nervous system, and things like DDT are linked to things like cancer. And actually, bisphenol A is what's called an endocrine disruptor, and you can see the reference at the bottom, especially the estrogenic aspect of things. BPA will actually go in and negatively affect the hormone receptors and maybe predisposing people to hormonal pathologies, and also to potentially increasing weight in obesity, like I mentioned. So again, another example. And again, because I'm a big visual guy, I like the aspect of this being now shown in kind of a chart form, where BPA and phthalates, another group of environmental toxins, where as we increase with age and as we get exposed to it, it actually has an effect on our genes. And our genes are responsible for coding for future generations and also for the function of our body. So ultimately, this is kind of the pathway of, one of the pathways anyways, is through the genetics, and not necessarily having a direct negative effect, but it can be actually transgenerational. It can be very scary of actually transferring a lot of these negative aspects to other generations through our genes. So there's a number of other examples I wanted to kind of highlight, and some of the associations that have been linked with specific environmental toxins. So things like sick building syndrome, we actually see where people in one whole building get sick all at the same time. Multiple chemical sensitivities, we'll talk about this a little bit later, where certain liver pathways are not working as efficiently and in balance. There's a large body of research with cancer, infertility, ADHD, Parkinson's disease that have all linked that these environmental pollutants do have a role to play. Are they the only role? Probably not, but there's actually a number of new research that's showing there might be a synergistic role. And in this case, you can see here at the bottom, Parkinson's disease often is found, especially clinically, I'll see it in populations that are exposed to pesticides, so things like farmers and that work in the agriculture industry, where there's a number of toxins being exposed over a period of time, they build up. And so there's a number of ways that a toxin or an environmental pollutant can get into our body. So just kind of quickly highlight a few. I think food is a really major way that we are exposed to. The second thing is actually bacteria. There are certain bacteria that live within our digestive tract and we can be exposed to that can also help kind of compound the problem of not able to be properly able to eliminate some of these toxins. We're going to talk about this more. And they can actually produce toxins themselves. So things like mycotoxins, and which also lead to liver congestion. Our household cosmetic products, our cleaning products, obviously the classic environmental exposure, electromagnetic frequencies. Now the research is growing. Recently there was a suggested link with long-term exposure with cancer. Younger and younger populations are using electromagnetic devices like cell phones, Wi-Fi computers, routers, obviously being exposed to things like high power hydro lines, and cell phone towers have had a number of negative effects, and they're growing in terms of number. And finally, actually our stress and our physiology can have a huge impact. If we're under a period of stress and it becomes chronic, if you don't have a chance to relax, the cells are in what's called sympathetic overdrive. So that's basically, we just don't feel that with our heart racing and our thoughts racing and we're breathing faster. We actually feel that right down to the cellular level. And what it does is that it makes us try to respond to that stress. So the cell kind of holds on to everything and braces itself. But if this is now a chronic thing, we don't want to be bracing ourselves on a cellular level for a long period of time, because then the body will not be able to properly release so many of the natural endogenous and exogenous, as I mentioned at the beginning, waste products and toxins that we need to eliminate. So there's a number of factors that contribute to the overall burden that a person may experience, and they all kind of have this negative synergy together. Here's a summary of some classic environmental toxins. I won't go through each one specifically, but we'll kind of touch on a few key points. PCBs, they're found in a number of sources, but flame retardants, so typically babies' clothing, babies' blankets actually now are being coated by flame retardants as a substance that obviously prevents it from catching on fire, but this is obviously the baby, a very sensitive organism, is exposed to that. Also farmed fish, especially farmed salmon, are being found with high levels of PCBs. So we need to be very careful with eating farmed fish. I'm going to talk about this when we get into the dietary section. I'll skip down to the pesticides and dioxins. We talked about pesticides already being linked to Parkinson's disease and others. Dioxins are those specific compounds that are formed when an animal product is actually charred. So that black char on let's say a barbecue, those are dioxins, and that's been linked with cancer. I talked about bisphenol A's and phthalates. Phthalates are commonly found in things like cosmetics, and they don't have so much of a very direct cancer effect, but they have a lot of a hormone disruption effect, which can lead to something like cancer. So it is definitely something that we need to avoid. Heavy metals are another classic one, and they're commonly found in things like paints. You can find them in water, and they're in the environment, and they definitely have a tendency to accumulate inside the body. Here's actually a great resource from the Environmental Working Group. Their website's ewg.org, and they create a little wallet card. You can put this in your purse and wallet, and they've compiled a list of the most sprayed fruits and vegetables versus the ones that are least sprayed. So the question always is, as we're going to get into, should I eat organic? Do I need to spend extra money on buying organic foods, and which foods should I buy? So this is a great list. If people, you don't want to go 100% organic, and that may be a little bit too expensive, this is a good guide. The ones on the left, the dirty dozen, is the ones that you really want to try to buy organic, and the ones that are least sprayed, you can definitely get away with not having to buy organic necessarily. So it's a really good guide, kind of a happy medium between the two. But again, resources out there for you if you're trying to make the decision between what's really, really contaminated and what may be a safer option. So let's look at some detox myths and misconceptions. We talked about a few already, but there's some key things. So I talked about wording being very important. A lot of times this term detoxification gets clumped into purification, elimination, cleansing. So we hear about things like foot baths, ionic foot baths. We hear things about saunas. We hear things about diets. We hear things about special protocols to go on. Oftentimes those can be linked into maybe classical purification of something a little bit more cultural like hydrotherapy, when detoxification can almost be linked with something like, you know, detoxification off using hard drugs, for example. So just from a term, I'm going to use the term detoxification more globally to really facilitate things like purification, cleansing, and include that and as part of it. But I think the best way to kind of describe it is elimination, because we are just helping our body lose the things that it should normally be excreting and eliminate them. And so that's a kind of a simple way without having to use the word detoxification. There's also the difference between using physiological and using supraphysiological. So something like making sure you drink enough water is normal, making sure that you're hydrated, with going on, let's say, you know, a 10, 20-day juice fast, that's a little bit more supraphysiological. So there's a differences there too. So I think, again, we're going to look at some of those differences. There's also a lot of problems with the term detoxification and the concept, because we're a very research-based evidence society. So we're really trying to find the causative factor. And as I already kind of described, it's very difficult to evaluate something that occurs on multiple pathways with multiple variables. Something like detoxification, as we're going to see, there are maybe 10, 20 different exposures. Now, in the body, there's also 10, 20 ways that the body gets rid of things. This is very difficult to assess. So I think that's one of the first problems when we run into evaluating detoxification. Also, as I mentioned, there's a lot of synergistic factors. And there's also a lot of specific molecules and compounds like mercury that are very difficult to detoxify. So you need very specialized, sometimes you hear the term chelation therapy. This is something that's used to get rid of heavy metals, because normal detoxification, like people may be using things like cilantro or things, they're healthy, but they really don't really pull out. If somebody has very high levels of mercury, they don't really pull those out very effectively and in a relatively short time frame. So all this contributing has led to kind of a negative bias in the conventional medical system against the term detoxification, because it's difficult to prove. That doesn't mean that it doesn't occur. That doesn't mean that it's not useful, and we're going to try to create a case for it as we go forward here. But I just want to kind of highlight some of the obstacles from the terms detoxification and some of the competing things out there. Perfect example is an ionic foot bath. These are classic things that you may find in a holistic health clinic, where it looks really, really fancy for those of you that haven't had one of these, but there really hasn't been a lot of evidence showing that these actually pull out toxic elements. There, on the flip side, sauna therapy, and especially infrared sauna, there's actually been a number of studies showing very beneficial effects on autoimmune diseases, environmental toxicity, and things like chronic pain with going through something like sauna. So this is a technique that really helps the elimination through the sweat glands and the skin, and it has some very positive health outcomes. So this is an example of something that has been traditionally used as cleansing and has very good benefits for it. Again, on the flip side, there's a gallbladder flush that maybe people have heard about, and there are some studies showing that, and some expert evidence by Dr. Gaby showing that even though there is some pumping out of the bile, where you actually stimulate the bile on the gallbladder to really be eliminated, which is overall, I think, a good thing. Doing a gallbladder flush may be unsafe for people that might have a blockage. So again, it's difficult to assess the evidence. So again, you can see how things get a little bit cloudy when there's one thing that might be very good and there's another thing that may not be very good. So I think there may be some positive evidence for some of these things. I do want to briefly talk about chelation therapy, because I think chelation recently has been actually done by a number of medical doctors from the conventional field that have realized that chelation therapy may be beneficial. And there's actually a lot of evidence for chelation therapy and the use for it in things like atherosclerosis, so the hardening of arteries. So there was a theory showing that maybe heavy metals and certain things like calcium, and even fluoride are being deposited in the blood vessels, causing them to be hardened. So this is a very recent trial, within the last few months, that came out last year, and they found that, again, it was met with a lot of controversy. It was using a specific chelating agent called EDTA. They were using some vitamins also. They found that it lowered some heart attack risk, improved diabetes, but there really was not an overall acceptance of the findings. So there needs to be more research done before this can be fully accepted. And again, showing that this whole concept of elimination detoxification, there's quite a bit of controversy out there among healthcare professionals. So what about diet? So we've also heard about the idea of that was chelation therapy. Now, what about some dietary therapy? We've all heard of going on a detox. Is there any evidence to this? And there's actually quite a bit of research showing the benefits of fasting. And there's a number of reasons that it may occur, but one of the most classic ones, as I presented in my cardiovascular and actually the brain health webinars, looking at reducing caloric intake, as you can see here on this middle point, actually has a benefit to brain health and actually the efficiency of the energy production in the brain. There's also studies for improvements in cardiovascular health. There's also some evidence showing that fasting or periods of fasting, especially under a medically supervised condition, has beneficial effects on improving chemotherapy and its effects, reducing blood pressure. And interestingly enough, as I mentioned, there's some cultural things with things like Ramadan in the Islam tradition that actually there is some beneficial effects when this is being done over time. So some very interesting research coming out with having some restricted diets. The key thing again is it needs to be within reason and needs to be done usually under a supervision of somebody that has the experience within the medical profession. And so as a summary, I just kind of wanted to highlight some of the beneficial effects of maybe having a restricted diet or intermittent fasting. So not fasting all the time, or maybe doing a few days or one day and then being back to the regular diet. So some of the effects, as you can see, we're not going to go through all of them, but you can see there is some positive effects on inflammation. It improves fat mobilization. You can see here, improves DNA stability. These are all very beneficial things. So the body does have these built-in effects. When we reduce some of the intake of calories, we may be producing some beneficial effects within the body. And so one of the main pathways that it has its positive effect, you can see here right at the bottom, is that it improves cell signaling and insulin resistance and reduces inflammation. These are really, really key things. And this is why that we can see some of the beneficial effects I showed on the last slide of improving blood pressure, possibly improving some chemotherapies, is because it's having this effect. Okay, so there also is an aspect of misunderstood physiology. And I think this is, a lot of us are guilty of this when we look at, especially in the conventional medical profession, because we really don't have a full appreciation for how the body properly eliminates. And there is specific pathways in the body that are kind of termed excretion and biotransformation. And we're going to look at each one of these in a lot more detail in the coming slides. But the body has a really great and intricate way of properly eliminating and detoxifying things waste that we find from ourselves and also that we get from the outside. So let's look at some of the ways that we can promote healthy elimination and detoxification. So these are some common principles. And so dealing with a patient or anybody that's looking to effectively have a detoxification regime in their lives and to improve their health, there needs to be a degree of elimination. So before you start adding in things that will possibly improve the elimination, you first need to get rid of the roadblocks. That makes sense. If you're going to run a race, take the garbage out of the way so you have a clear lane. That makes pretty good logical sense. And the classic thing is mindful of what you eat and be mindful of what you're exposed to. And so this is the first way of kind of clearing out things within your body. So refined foods usually are things that you want to really stay away from. Mindful of drinking water, and certain tap waters may have negative substances in them. For example, chlorine will not have a beneficial effect on the body. It will actually have a negative effect. And then obviously things as deep as mental stress can definitely impair detoxification, because I mentioned that increasing of the sympathetic nervous system and the sympathetic tone will allow the body, or kind of force the body, to hold on to things and not eliminate them properly. So the first thing, elimination. The second thing is finally addition. And start with diet, good positive lifestyle habits, high nutrient foods, low calorie foods. So fruits, especially vegetables, are going to be a huge part of any proper elimination and detoxification diet. And it's really one of the pillars of a successful program. And then good lifestyle practices like exercise, again, promoting the flow of sweat and blood throughout the body and lymph. Sleep is very important, is when the body actually goes through a lot of these elimination pathways. And then finally, the third step is actually called activation. And this is a step that kind of combines elimination and addition together. And this is where you'll actually add in specific nutrients and substances that will promote specific detoxification pathways. And this is where a lot of people really, they try to focus on, let's say, a specific product or a kit that they may buy at the health food store. And so this is where we want to make sure that we are going to be properly and giving a program that's going to be balanced to each one of the pathways that that person needs. And so this is kind of the three pillars of detoxification: elimination, addition, and activation. Okay, so as I mentioned, there's lots of things that come into our bodies in terms of toxins, but now this is a way of things actually going out of our body. And our body has some really very elaborate and interesting ways that we eliminate toxins. Just highlighting a few of them. We're going to talk about more specifically. Liver and kidney are the most common ones, so I'm not going to talk about them here because we're going to talk about them in much more depth. Intestinal tract, I'm also going to mention a very key elimination form. But some of the ones that we may not be as aware of. Lungs are where gas exchange occurs, so we think of always getting things out, but it's actually where we remove a lot of our carbon dioxide from our body. So our breathing out is as important as breathing in. Every cell in our body has detoxification pathways. Also the area outside of our cells that surround our cells. Our bodies are just not cells. There's also space. There's also protein and connective tissue between the cells. And so our extracellular matrix is very important because this is where a lot of things and waste can be stored. Our skin system and our lymph system are also very, very important. We need to stimulate all of these to have really effective detoxification. Okay, so let's talk about the liver first. It is the most important organ when it comes to detoxification, arguably. And the reason is that because it plays such a central role. You kind of have to think about it as the union station of the body. So this is the station, Grand Central. Well, all the trains come in and then they all go out. So whatever comes in, that liver has to deal with. And the liver has two main pathways that it goes through, phase 1 and phase 2. And I'm going to explore these in the next few slides. But a lot of times people think that, well, all it does is process, toxins. But that's actually not true. Anything that goes in our bodies, hormones, inflammation, any sort of signaling molecules, immune cells, they all have to go into the liver to be metabolized and to be transformed. So it's not just about environmental toxins. So if we have a lot of inflammation within our bodies, we will have a lot of stress on our livers. I'm not going to talk about this slide very much, but it's just really there to highlight. You can see there's some pretty extensive pathways within the bodies, and you can see this is kind of where it starts over here, where we have toxins coming in, and then it goes through a phase 1, an intermediary phase, which is right here in the middle, and then finally a phase 2 before it gets excreted. And if you get a chance, you can maybe go back and look at the presentation again, and you maybe even pause it here, and you can look at all the different cofactors and nutrients that are needed in each one of those phases, and I'm just going to highlight them there for you and how important. So we're going to talk about each one of those and really simplify this, because this is something that is more from a biochemistry perspective. So this is a lot better. This makes sense. for most people. So whenever something comes into the liver, it goes through 3 distinct phases. So phase 1 is usually where we make the molecule a little bit more ready to be excreted. So it actually, you'll add on a substance, and then it goes into phase kind of like 1.5 or 2, where there's toxic intermediate. So that molecule, let's say it's a phthalate that goes into the liver. That molecule is actually changed to something that's even more harmful, because for it to become more water soluble, we need to add certain substances to it before we can actually eliminate it, because it can't be eliminated as a fatty substance. And cytochrome P450 enzymes, these are very commonly known enzymes that a lot of drugs will use, but they're the ones that will go through and actually work primarily at phase 1. Phase 2 is often the one that gets overlooked, because it's fairly easy to increase phase 1, but phase 2 is one that we really need to also have a balance of. If we have imbalanced phase 1 and phase 2, then there's a lot of these middle guys being built up, which can actually cause a lot more harm before it can finally be eliminated. So we're going to look at each one of these phases a little bit more specifically, and then we're going to have a better understanding of how the liver actually has a detoxification role. Just at the bottom here, there is possibly a phase 3 or phase 0.5, where each cell may have a specific ability to detoxify. And so this actually has been found in some drug metabolism, where certain drugs are actually actively pumped out of cells. And this is actually bypassing the liver phases here. Okay, so phase 1. These are the key nutritional factors required for phase 1. So if you're deficient in, let's say, a specific amino acid or a B vitamin, then you won't be able to fully carry out all the roles that the phase 1 enzymes need to actually carry out. There's also certain things that we actually take in our environment through our diet or through our environmental exposure that will either increase, and that's what induce means, so it will either increase phase 1 or it will decrease phase 1, that's what inhibitors. So very commonly you'll find, and so there's good and bad on either side. Very commonly the most well-known one actually here is grapefruit. A grapefruit juice is a very common phase 1 inhibitor. So that's why you have to be careful with grapefruit juice, and when you take certain medications, like for example, you can see the benzodiazepine class of drugs. These are the kind of sleeping medications, anti-anxiety medications, that if you take grapefruit juice with these specific drugs, you will actually decrease the elimination of this drug. So you can actually have a toxic, much higher toxic effect because the body is not able to properly eliminate those drugs. So you can actually increase the toxicity. And so you can see that there needs to be a balance on both sides. So we'll explore that and how it kind of connects with different things. Caffeine, for just a more practical example, if you feel like caffeine really has a negative effect on you, like it really, you're not able, the smallest effect is you're not able to sleep after, that means that you may not have a you might not have enough phase 1 activity, or it might be inhibited. On the flip side, if you feel like you can drink 2 cups of coffee right before you go to bed and it really doesn't affect you, then your phase 1 may be working too much, and that's also not a good thing. And we're going to talk about that. That concept of balance is going to be extremely important. I mentioned about grapefruit juice already, but St. John's wort is kind of in opposition to grapefruits, where it will increase phase 1 enzymes. And so certain drugs, for example, birth control pills, will be broken down faster. So it may decrease the effectiveness of these drugs. So we need to know that a lot of natural things will have effects on how, not just on directly using on the same receptors and enzymes, but in terms of the way that something's eliminated, it will have either complementary or actually counterindicated effects inside the body. So these are some really key ways of supporting phase 1. So advanced B complex, I think most people are familiar with it for things like stress, but actually for detoxification and things like mental health, also very, very important because it provides those specific phase 1 enzymes with all the active cofactors that are needed to actually detoxify properly in phase 1. We're going to talk about this idea of mutations. And those are actually, remember, all those enzymes are made by specific genes. So if we have a tiny little bit of a mutation in one of those genes, we are not going to be able to fully use that gene properly. And so that's where actually having the active forms, and which is what advanced B complex does, and ortho core as well, will bypass some of those negative genetic things. And we're going to talk about that on the slide. Branched chain amino acids and amino acids in general, also very supportive. Amino acids are a key part of any sort of detoxification protocol. And one of the key aspects, the negative things that a person may do when they do a detox is that they totally restrict all their protein. And they do this, in the short term, it's not that big a deal because their body has some stores of the protein or the amino acids, but long term, the body's detoxification system will shut down and will not be able to properly detoxify. Okay, so now we're on that step 1.5, so toxic intermediates. And these substances are actually more toxic than when they came in the liver. And so there are key factors, and this is where antioxidants and things like plant compounds, selenium and zinc are going to be extremely important. So things, as I mentioned, ortho core is going to give you all those things. It has antioxidants, it has plant compounds, selenium and zinc within it. So it's really going to give you the best support for both phase 1 and phase 1.5. The key thing is you need a balance. There's actually quite a bit of diseases. Multiple chemical sensitivity is one classic example where actually phase 1 is working too much. It's too fast. And phase 2 can't keep up with it. So now you have a whole bunch of these toxic intermediates being produced and they're not being properly eliminated fast enough. So we need to have a balance between phase 1 and 2. Most classic detoxification kits will be great at increasing phase 1, but they don't really focus on phase 2 as well. And so this actually can have a negative effect on your liver health. Just a quick note about antioxidants. This is a really simple diagram, but it kind of rams home the point of how important and how an antioxidant actually works. So an antioxidant is one that a molecule that comes by and actually will absorb or donate one of these electrons. So this is an electron that sets off a chain reaction. This is a free electron that sets off a chain reaction and causes damage within a cell, and then an antioxidant will actually come by and it will rebalance this molecule up here, as you can see, the same one down here. So it will redonate that electron back, and so now this specific molecule is balanced. It no longer will go around and cause damage. It's important to understand how the antioxidants work within the body. Every single one of my webinars, I almost show this. I show this slide because it really can't be overstated how important the function of antioxidants, not only where they function. Vitamin E is in the cell membrane, so fatty tissue. Outside the cell, it's mainly vitamin C. Inside, it's mainly glutathione. We're going to talk much more about glutathione. And then also a lot of these other antioxidants, they support the function of these other main antioxidants like vitamin E, C, and glutathione. So we really need to create a balance of how we actually supplement antioxidants. And Antioxidant Synergy is an excellent example of a formula that is based on the principle of balance and actually supplementing antioxidants, not just one high dose, but actually in the way that the body normally uses them. So you can see complete form of vitamin E, specifically high amounts of gamma tocopherol compared to alpha. Most other vitamin E's will have higher alpha tocopherol, which actually will deplete the other forms of vitamin E. It's cheaper, so that's why a lot of companies will use it in their formulas. AOR has really tried to create a vitamin E formula in Antioxidant Synergy and also in Total E that has a focus on the beneficial forms of vitamin E, and gamma is one of the most beneficial. So it is much higher than the alpha tocopherol form. Okay, a quick note about selenium. Selenium I already mentioned as being very important for the for the intermediate, the phase 1.5 in detoxification, there's a number of studies showing that selenium has an anti-cancer effect, and they're actually suggesting that selenium, along with contributing to a healthy immune system, it actually is needed for the formation of glutathione to be properly formed in the body. Glutathione needs, or the enzyme that produces glutathione needs selenium. And so if you have a deficiency in selenium, which many of us have because it may be deficient in the soils and the diet, supplementing with selenium is going to have a very beneficial effect. So something like OrthoCore will have selenium in it, or you can actually use selenium, which is in the form of selenomethionine, which is an organic form of selenium, which is much better associated into the body, absorbed, versus the inorganic forms, which actually can have potentially a negative effect. So again, the form of the supplement, again, is turning out to be very important. Actually, dietarily, Brazil nuts are an excellent source of selenium. So that's from a dietary perspective. So make sure you get your Brazil nuts, but make sure they're fresh also, because we don't want the oils in the nuts to actually be rancid and have a negative effect. So we talked about phase 1, phase 1.5. Now we're moving on to phase 2. So this is the phase where we actually convert those toxic intermediates where the body is trying to create them so they're actually ready to be excreted. And now phase 2 actually adds compounds back onto the molecule and prepare it to be water-soluble and for it to be ready to be eliminated. And it's eliminated usually through the urine or the bile. So already like phase 1, amino acids, specifically taurine, glycine, glutamine, arginine, and orthonine are very important for the function of phase 2. There's a number of different pathways within phase 2, but some of the main ones rely heavily on these amino acids. They're usually named after amino acids, like the glycine pathway. There's a huge pathway called the sulfur pathway, and this is where things like garlic are often really referred to as detox-friendly foods because they actually increase the phase 2 compared to, let's say, having a deficiency in protein, or this is yellow food coloring, or low zinc, selenium, or glutathione will actually inhibit phase 2. So those are things that we want to avoid so our phase 2 pathway can keep up with phase 1 and we don't have some of the negative effects of the built-up toxic intermediate. We're going to talk about glutathione and sulforaphane specifically as we go forward. I kind of already mentioned this, but there's this genetic aspect of both in phase 1 and phase 2. Also in mental function there to a degree as well. There is a specific thing called polymorphisms, and what that is that there's a genetic alteration. You can see here in the diagram, it's a very small one. It's one that the body has difficult time picking up, and it doesn't eliminate that specific genetic strand because it identifies it being bad. It kind of flies under the radar, and now they have people that have these little SNPs, what's called single nucleotide polymorphisms. They actually have a protein or a gene that's coding for a protein that is not able to do its function as well. So there's quite a percentage of the population that may have a slower enzyme in the liver for detoxification. So this actually may account for why some people that smoke never get cancer, and some people that lead a healthy life and actually do have some sort of chronic disease. It's these metabolic differences within a person that we often can't see that may have risk factors for developing chronic diseases because our body is just not properly metabolizing and eliminating things. So cancer and Parkinson's disease are two of the classic examples. I mentioned glutathione. Glutathione is usually referred to as one of the most powerful, if not the most powerful antioxidant substance in the body. It's composed of glutamine, glycine, and cysteine, but cysteine is the specific component that actually is the one that the body needs and is limited if in the production of glutathione if it's low. It's produced by the liver, it's used all over the body, and there's a number of links to various health conditions, anything from Parkinson's to cancer to Alzheimer's. And now people are trying to actually use glutathione and its precursors to treat a lot of things and to help detoxification. The big key thing is as we use up and are exposed to a lot of toxins, we have a lot of excess load, especially on our liver, our body normally makes glutathione, but there comes a point where we can no longer keep up with the production of glutathione for all the things that it's needed. So that's where it becomes deficient, overwhelmed, and liver pathways, which heavily rely on it, can no longer function. Perfect examples are alcohol, acetaminophen, and fatty liver. All three of these actually deplete glutathione even more and will actually predispose you for liver pathologies and other pathologies because glutathione is not able to be produced. So I mentioned cysteine is the precursor for glutathione. So it would make sense to supplement cysteine in the form of N-acetylcysteine. This is the stable form of cysteine. And AOR is a formula that has 500 milligrams per capsule, so actually a very, very evidence-based dose, a very healthy dose to actually have a positive effect. And N-acetylcysteine is used in hospitals regularly for anybody that comes in for acetaminophen or a Tylenol overdose. It's a common antidote to a Tylenol overdose. Like glycine is actually an antidote for other overdoses when it comes to drugs. These amino acids are very beneficial for the negative effects of things, especially Tylenol in the body. Lots of different things it's been studied for. Lung diseases and brain diseases are some of the most common ones, and it's usually a very well-tolerated supplement. So N-acetylcysteine is a precursor of glutathione. There's actually been some evidence showing that N-acetylcysteine actually may kind of increase glutathione, which will promote the excretion of heavy metals, which is obviously very important if we want to get rid of those things. But we also have to make sure that whenever we want to start grabbing something like heavy metals and taking it out of the body, it also needs to kind of go through the body, go into the bloodstream before it's eliminated. It needs to go back through the liver. So we need to make sure that the person is able to actually deal with those things that are being mobilized in the body. So in cases of somebody that is pregnant, or if they have very, very high doses of, for example, mercury or a heavy metal, it may be best to avoid N-acetylcysteine or any other chelating type of agent because it may have a negative effect of mobilizing these heavy metals. So the whole point of this slide is to show that it's not always good just to really get everything out, because it needs to be done under a supervised, usually in a very professional way. And one of the best examples is heavy metals that are found in mercury amalgam, so mercury fillings in teeth. There's very specific dentists that are trained in the removal of these, and if they are not properly removed, you could actually have an increase in mercury because now there's a greater exposure. So there's some very specific protective things that need to be used. But mercury amalgams, fillings are a major source of mercury in the body. So another piece, as I mentioned, N-acetylcysteine is a very important increasing factor in glutathione. Whey protein's actually been studied for increasing glutathione. One of my favorites, because AOR's advanced whey has such a high level of alpha-lactalbumin. And this is a specific form of whey protein, a fraction of whey protein that has a lot of cysteine in it. And this is the one that has lower allergenic effect. We take out the beta version, the beta-lactoglobulin, and that's the one that a lot of people will have a negative reaction to if you're sensitive to whey. So we have a lower proportion of that. And there's a number of studies showing that whey protein can improve glutathione because, again, it's giving the raw material for the body to produce glutathione. And so glutathione will be produced when the body has enough amino acids. So amino acids and protein are excellent detoxifying supportive agents. Oral glutathione is now being found on the market, and it's very difficult to absorb this specific type of glutathione. That's why N-acetylcysteine has been used so commonly. And so there are some on the market, and there's some research being kind of put into potentially looking at different enhanced bioavailability delivery systems. So there is some evidence for that. So as of right now, most formulations really don't have good evidence showing that they're actually absorbed, because the glutathione actually is a very unstable molecule to start off with. It goes into the gut, it's broken down in the gut, and then it needs to be somehow reassembled within the body. And again, that may not be an effective way of increasing levels of glutathione. So why not give the building blocks like N-acetylcysteine, and the body will make it as it needs it. One of AOR's classic liver formulas is called liver support. It used to be called ortholiver. And the key ingredients are milk thistle, Chonka piedra, or the Latin name is Phyllanthus amarus, and NAC, as we talked about. There's also broccoli extract that I'm going to talk about. And this is an excellent overall liver supportive formula that is great for liver infections. So hepatitis is a major indication. Also for general liver protection and to promote healthy detoxification. So it's a really great overall liver supportive formula. And what I really like about this one is that the doses that are found in it and the ingredients are very evidence-based for them. So it really gives you that trust of what formula that you're taking is going to be increasing not just phase 1, but also phase 2 as well. And that's a very important aspect of any formula. Milk thistle is probably one of the most well-known herbs when it comes to liver health. It's a classic liver protectant. It's been studied in hepatitis. And there's actually some studies showing that it actually protects the cell, the hepatocyte, from being invaded by the virus. And so it has almost like a cell protective effect. It's been used in cases of cancer where it has, again, chemotherapy and certain conventional treatments can be very difficult on the liver. And one of the main things is to watch the liver to make sure that it's not becoming damaged. And milk thistle is one of those things that has an anti-cancer effect, so to speak, but it will help protect the liver during things like chemotherapy. So again, whenever it comes to cancer, always be very careful and use caution and see a qualified healthcare practitioner if you're going to be recommending or taking anything like that. SGS, or often known as sulforaphane, and they're not exactly the same, but they're found in the brassica or cruciferous family of veggies. So those are your Brussels sprouts, your broccoli, your cauliflower. And actually, SGS is the precursor to sulforaphane, and the bacteria in the gut actually convert it. And SGS has a lot of very potent actions in the body. It's a very potent anti-inflammatory action. It has specifically, this is the specific nutrient that increases phase 2. And that's really important because a lot of times people's phase 2 liver enzymes are not working as well, and we need to increase phase 2. It's one of the most potent phase 2 detoxifiers. And so there's a lot of research now being used with SGS and sulforaphane, and that's one of the main reasons that the cruciferous family of veggies, or the brassica family, that's why they have such potent anti-cancer effects. One of my favorite herbs is called Phyllanthus amarus, and the standard name is called Chonka piedra. This is a herb that is actually from the Amazonian tradition of medicine, and it has a wide range of effects, and AOR is one of the few companies that actually have this herb. And to my knowledge, it's the only one in Canada anyways. And this herb specifically has some very unique characteristics. It has a really beneficial effect. It's been studied for hepatitis. It's a bitter herb, so it'll improve bile flow, which is always good because bile is a way of eliminating things. It has antibacterial effects. But what's most interesting and unique is that actually it's been studied for improving kidney and gallstones. So people that have kidney and gallstones, which many people do for a number of reasons, and classically they are, again, not eliminating their bile well enough, so it becomes stagnant. There's almost like a sludge that's formed within the gallbladder. This is a specific herb that will improve the bile flow, and it's been studied to reduce both gallstones and kidney stones. So a very unique action for this herb, and I've seen it work clinically, and also there's a number of trials that have shown that they have a decreased need for other treatments for gallstones and for kidney stones. this is kind of a really nice overall summary picture of the elimination cycle. So if there was one slide that you would remember from this whole presentation, this would probably be it. This one, along with the liver, the phase 1, phase 1.5, and phase 2 pathways. So let's follow this pathway. So we take in a food, or we are exposed to something. The first thing that that food or toxin, let's say, will be exposed to is the intestinal barrier. So if our intestines are not functioning properly, and they're not properly tight, and they're not protecting ourselves from the external environment, they will be what's called leaky, and they will no longer be able to have that adequate barrier to keep things out. So this is the first thing. This is our first kind of line of defense against making sure that we're not absorbing negative things. So our intestinal barrier is very, very paramount. Second thing is that every single piece of blood or a drop of blood that comes from the digestive tract goes into the liver. And that's what's called portal circulation. You can see that right here. And portal circulation goes through the phase 1 and 2. So this is called the first, there was first pass. This is usually called the second pass, where phase 1 and 2 are increased or decreased depending on how that person is doing. And then we go through 2 ways of being eliminated. So one of them is through the kidneys, or the second one is through the bile excretion. So the bile duct is concentrated in the gallbladder, and then the bile ducts excreted back into the intestine. So this is how important the intestines are. They see a toxin potentially twice. And so what the body does is that because it wants to conserve a lot of the cholesterol and the specific hormones that we may have in our body, it actually will reabsorb some of those things, and that's what's called enterohepatic recirculation. So if our gut is not working properly, we don't have enough fiber, we can actually be reabsorbing all the things that we excrete, or at least a proportion of them. And so that's what's called enterohepatic recirculation, and that's very important to make sure that that pathway is healthy and we're not reabsorbing toxins. And then finally, there's stool elimination. So ideally, the stool will lock up with enough fiber, with enough bulk, will lock up some of those toxins, and they can be excreted. But you can see why this can be a very vicious cycle where the body actually is holding on to some of these things, because that's the way that we've been able to survive evolutionarily. Just a quick note about kidneys here. I'm not going to really get into the kidneys because there's the liver is a lot more important when it comes to the phase 1, 2, but kidneys are extremely important. And we can almost talk about the kidneys for a whole separate webinar. But the kidneys are very important because they really regulate, they filter the blood, and they regulate our electrolytes. So our electrolytes are very important for maintaining balance for when it comes to blood pressure, when it comes to things like stress, heart health. A lot of heavy metals can actually be deposited in the kidneys as well. So kidney status is very important. Oftentimes when we take care of the liver, and we take care of things like diet, our kidneys will also improve as well. So there are specific things that we can do, but liver is the first thing that we usually work on. Okay, so I talked about the intestines, and I'm just going to kind of breeze through this because I mentioned a lot of this in that diagram. Again, mentioning the permeability of the integrity of the gut lining is very important, and also the bacteria is very important, because the bacteria themselves, if we have probiotics, which are very beneficial. There's more probiotics inside of our digestive tract than we have cells within our body. So there's a huge beneficial effect to all the things that the probiotics do. But there can also be negative bacteria in the gut, and these can actually produce toxins. And so our gut microflora, or our gut probiotics, need to be balanced and need to be healthy. Otherwise, we will not be able to properly do this enterohepatic recirculation, and there won't be a proper elimination of stools. So we may be reabsorbing toxins again. I have to say, I've really gained an appreciation for the Ayurvedic line of medicine, because they've really been doing a lot of things that have had some great effects for thousands of years. And specifically, what I like about Triphala, it's the formula of 3 herbs, Ablymica, Terminala, Beringia, and Terminala cerbula. They are the components in Triflax. And it's now being studied, as you can see, for a number of things. And we're going to touch on this in the next slide. So it's been traditionally used as a laxative. It has a gentle laxative effect, improves digestion, and as a colon cleanser. So it's kind of been used traditionally as a colon detoxification herbal formula. There's some really neat research coming out because these specific herbs that are in triflax, that in the combination called Hrkal, they're really rich in phytophenols. So ellagic acid is actually found in pomegranates and a lot of other plants, but it's been studied for its cancer protective effects. Very interestingly, and I didn't even know about this until I looked into some of the research, is that there's some studies on weight loss, that triphala has actually been used in RCTs in randomized placebo-controlled trials for weight loss. And they found that there was a significant weight loss after 3 months. So there's some really interesting benefits of triphala, and I really have a newfound appreciation for this Ayurvedic formula. It's very safe. There's some immune stimulation, because remember, our gut is where most of our immune cells are found. And so if our gut and our probiotics are not properly moving and balanced, then our immune system will not work well. Okay, so I mentioned SGS already. Cellular detox is a component of, it's a formula that contains SGS. And Dr. Chantal Dumas talked about estro detox in her women's health presentation. I believe it was in August, and I'll talk about it again very briefly. But cellular detox is kind of a counterpart where it's a real focus on the digestive tract and the cellular level. It contains a specific bacteria along with SGS called Bifidobacter longum, and this is a very specific strain that actually has been shown to improve immune stimulation. So it's been studied in influenza prevention, and it also prevents the bacteria inside the gut that will increase carcinogen formation. So it's, again, that good bacteria that will counteract the negative bacteria that may be trying to get a leg up inside the digestive tract. The other main ingredient is called calcium D-glucarate. Calcium D-glucarate is a specific enzyme found in, again, those cruciferous veggies that inhibits an enzyme called beta-glucuronidase. This specific enzyme inhibits the pathway that is actually found in cells and actually in the liver as well. So this enzyme, if present, will inactivate the glucuronidation pathway. And this is a very key pathway for detoxifying toxins and carcinogens. And it's also a very key pathway in hormonal detoxification. As I mentioned, the liver does a lot of hormonal elimination. So if we want to have healthy hormonal balance, we need to make sure that our liver, which is the big processing plant for hormones, is actually eliminating the excess hormone. So classically, estrogen will be the one that typically most women will have elevated levels of, men as well. So calcium D-glucarate will make sure that this glucuronidation pathway is working well and it's not being inhibited by certain enzymes that have a negative effect. So just to continue on with hormonal metabolism, as I mentioned, estrogen, the liver is very important for the elimination of especially excess estrogen. We know that too much estrogen, too much of any hormone will have a negative effect. In this case, estrogen is very negative because there's specific cancers, especially breast cancer, that will have an increased risk of when there's hormones that are at elevated levels, when estrogen's high. So it's important to recognize that there's also many different types of estrogens. The two main types, and this is why hormones can be very confusing for people, is that there is the 2-hydroxylated estrogen form, which has a protective effect. So this will actually come in and have a protective effect on the estrogen receptor. The 16-alpha-hydroxylated estrogen is the one that has a negative effect, so that stimulates a negative pathway. So it's almost like using two different keys. They both work, but one turns a negative pathway on and one turns a positive pathway on. So if we can increase the proportion of the 2-hydroxylated estrogen, we will have a better hormonal metabolism of estrogen, and so therefore reduce the risk of some of these hormonally sensitive cancers. Probably the most well-known hormone or estrogen metabolizers called indole 3-carbinol. Again, going back to those cruciferous or brassica vegetable families. And this is a specific substance that increases the 2-hydroxylated form and decreases the 16-alpha hydroxylated form. It's been studied quite extensively in a carcinoma of the cervix, so that's cervical cancer, and especially the forms of the pre-cervical dysplasia. So that's a very common thing for a lot of women, usually the first sign of cervical cancer. So it's actually been studied in animals, and also there's ongoing human trials for indole 3-carbinol. So again, promoting that healthy metabolism of estrogen. EstroAdapt, as I mentioned before, we already talked about calcium D-glucarate, so that's making sure that the liver pathways metabolizing hormones properly. Sulforaphane increases phase 2, which can also be often very stifled in excess hormonal states. Just recently it was renamed from EstroDetox to EstroAdapt, so we added in choline, which is a cofactor. It's a fat-soluble cofactor for phase 1, and it contains a specific nutrient called DIM, diindole methane. And basically that's the active form of I3C. That's what the body converts I3C into, and that's what has the active effect on the cells in promoting healthy estrogen metabolism. It also contains a specific phytoestrogen that, again, this estrogen will have that positive effect on that receptor. It's been studied for decreasing hot flashes, promoting healthy estrogenic metabolism, and so it's, again, often a part of a protocol for a lot of naturopathic physicians and a lot of people that have excess or elevated levels of estrogen. Lastly, I want to touch on just a term called methylation. So I mentioned, remember, in phase 1 of liver enzyme detoxification, there is a number of enzymes that work, the P450 enzymes, and they require certain B vitamins, and they require activation through methylation. That's what B vitamins do. They methylate. They donate these groups of methyl, these methyl groups. And so SAMe, classically being used for depression, actually is required. It's one of those molecules in the body that is a very powerful methylator. And so what's that really mean without the biochemical jargon? Methylation just basically means it turns molecules on. And so in the case of the liver enzyme, it wants to turn on the enzymes that are required to form glutathione. And when the liver is overburdened, especially in chronic liver disease, the SAMe, which turns on a lot of these key cofactors, intermediate steps, is actually inhibited. So we want to make sure that our B vitamins and our methylation pathways are really, really working well. And SAMe is an excellent form of methionine, which is a key cofactor when it comes to liver enzymes. So again, SAMe is very, very important. So just to finish up, I did have a chance to talk about these 4 products, but I think they're worth mentioning because, as we're going to see in the last few slides of this webinar, I mentioned a lot of things about activating certain liver pathways, activating certain hormonal pathways of elimination, and all these things will increase the elimination through phase 1, phase 1.5, and phase 2. However, we have to make sure that our digestive tract, where all these things are being funneled into, once they're being detoxed by the liver, that they are actually being properly eliminated. So fiber and the integrity of the intestines are super important. So Solufibers, again, one of my favorite supplements. It's one that I personally take fairly often because it's so easy to take. It dissolves in water. It's using a soluble form of fiber called guar gum, where actually if you have enough fiber within your diet, it promotes the growth of healthy bacteria, it promotes healthy bowel movements, and if you have healthy bowel movements, which is usually once or twice a day of a healthy elimination, you will actually not be reabsorbing some of those negative toxins. So Solufiber is an excellent fiber formula to increase the elimination. Glutamine, probiotics, and a digestive enzyme with either AOR enzymes or digestes, again, takes the pressure off the digestive tract and on the probiotics to actually properly metabolize food that is not being broken down properly, and it just reestablishes the balance. This formula right here, these 4 products will be an excellent combination to start with before even embarking on any sort of liver detoxification pathway. And the reason is, as I'm going to mention, think of the body as a river that is overloaded with garbage. It's overloaded with toxins from all the reasons we talked about, whether it's phthalates, whether it's heavy metals, whether it's hormones that are not being properly metabolized, inflammation, all that stuff's in the body, and it needs to be removed. And the body needs a little help to remove it. So if we want to remove those things, we need to clear the pathways. So I talked about already elimination of the toxic burden. So obviously stop the flow of burden, stop the flow of toxins coming into the body, both lifestyle, cosmetically, externally, and dietarily. Number 2, increase high nutrient density foods. So that's that addition. So increase foods that's going to naturally promote healthy elimination. And here's number 3. So at this point, we haven't even gone into going in and upregulating phase 1 and phase 1.5. No, we're really just creating the environment for things to actually be removed. This combination right here, the elimination support, is actually great for number 3. And that's actually one of the first steps of kind of helping the body through some of these elimination pathways, is that it helps clear downstream, so our intestines, before activating upstream. So it'd be the same as if we wanted to drain our sink of junk, let's say after washing our dishes, and we started pouring in that junk from all over, from different pots and pans, but we didn't unplug the drain. We first need to clear the drain, allow it to be nice and free-flowing, and then finally we can go into supporting digestion, making sure that the first line of defense is good, and then finally going into increasing, making sure our liver enzymes are balanced, not increase one or the other. If we have too much phase 1, then our phase 2 is not going to be able to keep up. If our phase 2 is working too fast, phase 1 is not breaking things down, we're not going to feel very good. We're going to have lots of symptoms as well. So we need a balance, and that's a key thing to remember. And then finally, making sure we have enough antioxidant support. And so we have cofactors that normally the process in the liver that are being properly detoxified. So ultimately, we're going to end up with something like a river that's nice and clean, that's flowing well, that's nice and fresh, and that is there's easily, if there would be some toxins poured into that from our bodies and our pathways, our body would be very easily able to deal with it. So that's the webinar all about detoxification. Thank you all so much for listening. We appreciate every single one of you coming. We hope you stay tuned to our next webinar coming up in April. That'll be posted at the beginning of the month. And again, I really hope that you took away from this presentation that detoxification and elimination are key components of what the body normally does, and we need to stimulate it in proper succession and kind of give the body a little bit of a break and a little bit of support just to kind of get through some of those obstacles that we may be having. Oftentimes, be careful with just going with one quick fix supplement and thinking that we're actually going to be detoxifying. As you see, the way that the body takes in toxins and the way that it eliminates, it just doesn't do it through one way. We need to stimulate all the ways that it does it. Otherwise, we may actually be hurting ourselves in the long run if we have a build-up of some of these things, some of these toxic intermediates that may have a negative effect. So it's all about good, healthy balance. And if we stimulate this, it's really, efficient elimination is really the root cause of so many, if not all, diseases. It's something that we need to really, really take seriously and really try to do. So thank you so much for attending, and I wish you the best of health and best of luck.